Mesothelioma survival rate. Mesothelioma survival rate. How long can I live with this disease? Is a common query for those who have been diagnosed with mesothelioma. Indeed, many patients will turn to their doctor with this question, as will their concerned friends and family fellows. As with most diseases, however, there is no one answer as to the life expectancy of a mesothelioma patient. In common, the mesothelioma survival rate is based on a number of different factors. Every case is a little bit different, and although the survival rate for mesothelioma fatalities has usually been grim, more and more patients are living longer with the disease as scientists discover new and more effective ways to spot the disease and to treat it. Survival rates for mesothelioma patients are dependent upon a variety of factors that may include any or all of the next. Mesothelioma latency period. Mesothelioma is an unusual form of cancer in that it has a very long latency period. Essentially, this means that the sickness often hides in the body for many years, sometimes for up to 4 or 5 decades. Hence, 40 to 50 years may have passed since initial experience to asbestos first occurred. This extended inactivity period also means that the disease is not detected until indicators arise. Often, by that time, the cancer has been from the primary area to other parts of the body. Stage of disease. At the time of diagnosis, individuals whose mesothelioma is discovered in stage 1 or 2 have a greater chance of surviving the disease for an extended historical time due to the fact that more treatment options will be available to them. Individuals diagnosed with stage 3 or 4 mesothelioma will have fewer management options, and thus, the less favorable prognosis. The worst mesothelioma prognosis is seen in patients with advanced cancer that contemporaneous or are symptomatic with distant metastases of the primary tumor, i.e., the cancer has spread from the primary capacity to other parts of the body. Operability of the lump. Due to the above-mentioned latency period, surgery to confiscate the primary mesothelioma tumor is often not in selection. However, if the disease is naked in an early stage, the surgical procedure to remove the tumor may be a possibility, especially when the patient is otherwise healthy. Age of the patient. The earlier the patient, the better the chance for survival. Studies have shown that age does indeed play a factor in survival rate, and young patients definitely fare better. Comorbidity with other sicknesses. Patients, specifically older ones, who have many other medical issues are less likely to survive for any length of time with mesothelioma. This is especially true with adult patients, who account for huge numbers of mesothelioma losses. Heart disease, kidney problems, diabetes, hypertension, and a host of other illnesses or disorders can brutally impact treatment options and, hereafter, shorten the patient's lifespan. Mesothelioma treatment plan. The length of time a mesothelioma victim survives may depend on the treatment he receives. Top mesothelioma doctors will be as aggressive as possible, understanding that this is a tough cancer to treat. Area and type of the disease. Mesothelioma comes in several forms. About 75 out of 100 of cases appear in the pleural, 15 to 20% in the peritoneum, and just 5% in the pericardium. Pleural mesothelioma is easier to treat, and patients will generally have a longer mesothelioma survival rate than those whose infection is centered elsewhere. In addition, those with epithelial mesothelioma, most cases are of this type, have a better prognosis than those with other kinds of mesothelioma.